Dr. Natalie Marks, and we're back with a quick cup of knowledge. Joining me today is Megan Brashear. Megan is a registered veterinary technician with a VTS in emergency and critical care, and is also the small animal veterinary nursing manager at the Purdue University Veterinary Teaching Hospital. Thanks so much for joining us today, Megan.
Of course, thanks for having me.
Yeah, we're very excited to talk to you today because you have a wealth of knowledge in a lot of different areas and a lot of non-traditional areas for technicians. So let's dive right in. You have been a technician now for almost 20 years.
Yes.
And what we found out, a very early adopter of the VTS, the specialty. Can you talk about that? And I know you have some mixed feelings about when you did that in your career.
Yeah, I got my specialty in emergency and critical care in 2004. So I had been a credentialed technician for just right about 4 years when I took that exam. And I passed the first time, which was amazing, but I learned so much, way after that, really. The study process was really challenging for me, kind of still learning how to be a technician and then trying to get to this much higher specialty level of knowledge. So while I love the VTS process and I love that there are so many different academies now and opportunities for technicians to get their specialty, there's no rush. So get in it and do the job and learn things kind of organically in the beginning, and then say, okay, I'm ready to take this big step into a specialty. I'm ready to do all of that studying, because it's not a race. So just, get it done, but you don't have to do it super early on in your career.
That's great advice. And you're going to be lecturing here about thriving, just not surviving. And I love that topic because I think so many of us get into this rut every day of just got to get through the day, and maybe not really making the most of every moment and every opportunity. So for the technicians that are watching this and maybe feeling a bit plateaued or stifled in their current position, can you give us a few pearls or kind of inside tips on what you're going to be talking about?
These are, there's two things that I have really kind of adopted into my life. And I feel like so many of us in veterinary medicine are in survival mode. It is get up, it is just to make sure I get treatments done, just to make sure I get through the day seeing these appointments. And we kind of forget to be involved in it, to really get into the medicine, to really get into that client interaction. And so the first thing, I've had to adopt this myself and work really hard at it, is to assume good intent. And that's something I chant to myself in traffic every day. That's something, if a client makes a decision that I might not agree with, or working in emergency, we see animals that have maybe been sick for a long period of time, and it can be very difficult for us in that situation, trying to do the best we can for this animal, and we find ourselves coming up against the client instead of working together. And so when I kind of find myself getting angry or find myself saying, why didn't they, why did they, why won't they, to just step back and say they're here and they're doing the best they can. And if I assume good intent from that client, it makes my life a whole lot easier. And I am not as angry, and I am not viewing the client as a barrier to me being able to do my job. We can view them as part of the team. And that's just been so helpful for me to just feel happy while I'm at work.
Yes.
It helps with coworkers, when we spend time with people that we might not like as much as our family, for instance, we can kind of, run into some interpersonal issues. And so if you just stop feeling like that person gets out of bed every day just to make my life miserable, if I start saying, maybe they have something else going on in their life, or they are doing the best they can, everything's going to be great. It just makes my life a lot easier. The second thing is to just stop judging. And they do go hand in hand, is to assume that good intent, but just to kind of let those things go and just not think that I know the best for everybody all the time. And when we get into that cycle of thinking that we are the only ones who will do everything right all the time, I just think that's a really dangerous place to be, because we're never going to be happy. Nobody can ever please us. Nobody's ever going to do exactly what I want them to do. So if I can just let that go, I am so much happier. Even 20 years in working in specialty, working in management, I still love what I do, and it takes a lot of work every day to not judge people, to assume that they're doing the best they can. But in the long run, it's easier to sleep at night, not having all of that burden on my shoulders every day.
I want to work with you every day. I love these mantras, and gosh, if everybody could adopt those, there'd be so much more kindness in the world
That's
too.
what I'm working on. Yes.
Wow, I hope I can attend your lecture. But you mentioned, again, you've been in specialty, been in management. Now you're at Purdue and you're managing the nursing program there. And you were saying that in just a short period of time, you've just had this really eye-opening experience of all the different opportunities. Can you share more of that?
Yeah, it's, I've always known that there are vet schools out there and that they have hospitals because that's how they train vet students. But I had never been to one. I'd never worked in academia. And seeing the opportunity that veterinary technicians have working in these hospitals has been incredible. The level of medicine is awesome. We have a lot of toys. We have just so much opportunity to do advanced procedures, not just in the ICU, but in dermatology, and we have a behavior section, and we have internal medicine is doing all kinds of crazy things, and cardiology is putting catheters and balloons, and it's just really cool to have the opportunity to have access to that level of medicine. And then the technicians that are placing central lines multiple times a day and getting to participate in these super cool anesthetic procedures. And so all of that, plus we get to tell vet students how amazing technicians are. And that's part of what I want to do is I want every vet student who graduates from Purdue to go out and say, I need a credentialed technician or 20 of them, just like the ones I had at Purdue. And so that's how I want to contribute to veterinary technicians, and how we can move this profession forward is to really help these students understand how we can be so important and vital to what they're going to do in their professional life, and they cannot do it without a lot of good technicians.
I would be the first to tell you that as a practicing veterinarian, I would be lost without my technicians. They really are the heart of the hospital.
Good. Yes.
And so I totally agree with you. On that note, though, I really want to touch a little bit more on what you're teaching the veterinary students about the technicians specifically, because it all starts so early, right? And if we, just like you're saying, if we can start new veterinarians out with this kind of mindset, I think it definitely will change a lot of the quality of medicine, and also, more importantly for technicians, not be taking away their skills, right? Because we want them to be able to maximize their skills in practice and not be having the veterinarians doing some of those technical skills that technicians are much better at.
Yes.
So how are you doing that?
A lot of it is just the opportunity to work alongside them. So we're bringing vet students into the hospital at Purdue earlier and earlier. It used to be just the fourth years would spend time in the hospital, and now we're seeing some third years doing rotations through there. And so starting them early, having access to the technicians. And I want them to learn how to do things, but they need to know that a technician is going to be there to back them up, and that they're always coming to us saying, this dog has been here for 5 days and it's been poked a lot of times. I don't want to mess it up. Will you please do this blood draw? And not just the technical skills, but having them come up to us and say, can you help me with what's going on with this ECG? Or can you explain, the disease process that this cat is going through? And so I enjoy the technicians being able to interact with the vet students that way, so that they realize that we're not just there to draw blood, we're also there to help clients understand disease processes and to kind of fill in the gaps with some of those. I feel really confident with what's happening in the ECG. Let's run through it and really help you understand it as well. And it's just getting in and doing some classroom teaching with them and just saying, look at how awesome technicians are.
Yes.
and making sure that they understand that it is a team effort, and they know that they're going to have a lot harder time getting through their treatments if they don't have the technicians there to back them up. And so that's really just my goal is to help them understand how much we can do for them.
That's fantastic. I love what you're doing for the profession. I love what you're doing to better technicians and also this team approach, both from a physical integrated, but also emotional wellness, which we all can work on, right? So best of luck to you in your journey. Thank you for all you do, and thanks for joining us here.
Thank you very much.